on what Laura mentioned around our telehealth services. So due to COVID-19, we experienced a sudden shift in sort of our treatment modality, which Laura mentioned is face-to-face visits. That's something that we're very good at. That's something that we have found excellence with. And the realization that then needed to shift over to telephonic services. When we started doing telephonic services, we realized that there needed to be an enhancement with that, and that enhancement was video conferencing or telehealth. Just, many telephone conversations worked, but at the same time, seeing someone on the other side, it creates such a more therapeutic dynamic session. So based on that realization, we quickly developed a kind of like a task force for telehealth, realizing kind of what was missing and how we needed to move forward with telehealth. And a number of things have come out of that task force over the last multiple months. One of the first things that came out of that task force was the development of a pilot with 8 different clinical and departments, and just realizing what improvements that we needed to make with telehealth. And those improvements were around workflows, were around a platform that we chose, which is DoxyMe, as well as other platforms that are available to us. And then also the realization of functionality. Functionality not just for our staff, but for persons served. So what shortly came after that pilot was ongoing training around telehealth, and trainings around that functionality and the importance of not just our staff understanding how to access these different platforms, but also how we can share and teach our clients how to access that platform, because that's such a large piece of it, and I'm sure Joris is going to talk a little bit more about that. We also had to do a bit more research with telehealth and the rules and the regulations around that, and then develop our own policies as it pertains to those rules and regulations. And lastly, in addition to that, just getting more access to person served. So as Laura mentioned and as you mentioned, we quickly found that person served, our clients, didn't have access to smartphones, didn't have access to consistent and reliable internet. And we also found that a lot of our clients didn't have access to cell phones outside of telehealth. So providing that, and one of our major providers, one is the CARES Act, so thank you. And then the other piece is, in terms of a provider, is the Missouri Health Net. They have offered 300 hotspots to the agency. And then in return, we were able to purchase 300 telehealth devices. So we are in the process of disseminating that out to our staff and to persons served, along with that training component. So much of our forward movement with this has been around the CARES Act, additional funding, and those hotspots, which is just so key in terms of what you said regarding access to the internet.